So this, what you call a global vision is very much what is inspiring and providing direction for some of the local activities that we do. So we try to sort of think of it as a continuum that, thinking about the universality of the themes that we do is essentially what needs to be in the back of our minds when we're trying to sort of ask, well, how do we deal with some of the challenges in our own community? And I want to give you a few examples of what we're doing to move that needle, if you like. So this is sort of an illustration of a research community partnership that we've developed. So we call it Spectrum of Care. And it brings together, obviously, at the center, children and families that we work with, what we call big science networks. These are large-scale studies that directly draw on their samples from our community. So there's over 500 families in Quebec at large who are actively participating in research related to these studies. And increasingly, we're working to get the researchers involved to have sort of concrete links with community representatives to both improve the research that we do, but to also link with some of the priorities that the community has itself. So we also link with community services. I have a formal affiliation with a couple of these that sort of as a member of staff, but there's sort of a broader number of frontliners that we work with, whether they're in the area of diagnosis or in school services, as well as our international partners, mainly Autism Speaks and the World Health Organization, who were very instrumental in one of the directions that I would talk to you about. So it's really, the cool stuff happens in between those spaces, right? The sort of space that brings us all together. And I think it protects against something that Dr. Grinker talked about this morning, of basically how sometimes the idea of scientific or medical authority can take us in really wrong directions. And I see this sort of connectivity as protective of that, right? Because when we come together with these organizations, the idea is that we have something equally beneficial to take out of it. We have something to learn from that community. It's not sort of a directionality issue where we're providing knowledge and understanding. So it's really a kind of a bi-directional benefit that we have with them. One of the things that we started sort of immediately doing, you'll see, I picked out a few examples from a website called Spectrum. This is a news journalism platform. If you don't know it, sign up. It's one of the most productive and really fantastic places to get autism research news. And they've done a number of sort of in-depth assessments of topics that are really very controversial in the scientific community and have a big impact on what we're doing in terms of our connectivity with community partners. So one of those themes in research has to do with the genetic diversity, right? So that we're no longer looking for the underlying gene for autism or the underlying brain difference for autism, right? We don't use that language anymore. Now it's all about building these very large-scale repositories of DNA samples and then trying to sort of work the other way around, trying to start with the biological difference and asking, irrespective of what kind of label or diagnosis you have or the lack of a diagnosis that you have, what is the impact of this difference on your behavior, on your development? So the idea is that this would give us a good window to understand what these biological differences end up causing down the line in terms of your behavior and development. So what we've done in Montreal is essentially targeted this idea that previously a lot of our research had been fairly underrepresentative of our true population characteristics, right? So this hyper-diverse population, because previously we only included you in research if we can run an ADOS and an ADI, sort of like these two artificial tests. Well, you know what? There are copyright limitations that actually prevent you from running these with a non-English or French speaker. Unless we have sort of an adaptation, we go and buy it, then we're not able to have that score or test. And many of us think that that's just not acceptable. And that's sort of an unethical practice in research to be excluding people because of limitations of the tools and instruments that we have. So we essentially removed that completely as a kind of an initial entry criterion. And we're also working with essentially the largest diagnostic centers. So there are 4 big hospital-based centers in Montreal to come up with a common platform for research where we're relying primarily on data coming from the clinics themselves. right? Previously thought to be very problematic for research because it's all very noisy, but now we think that actually we've been missing out on really good noise that we could use to explain some of the patterns that we're seeing at the level of biology. So this is what sort of we call the Montreal 1000, and the idea of it is that we would like every family that comes through one of those diagnostic centers to have an equal opportunity to choose to participate in research. Right? We'll know how successful we are in a few months, but there is certainly enough momentum, and I think where we've sort of overcome a lot of challenges is that typically our city had been kind of divided in a line in the middle, on an English side and a French side, so at least we got rid of that, and we're unifying sort of that platform to have this better representation in our studies.